Hello everyone, this is software of a dentist. I have prepared for one of my client, Mr. Dr. Zenith, and I'm going to demonstrate it right now. First of all, you can see there are 6 tabs or 6 buttons in here. These are appointments, new patient, search and report, prescription, account, and exit. A doctor can set up or manage the appointments by clicking the appointment button. This is it, and he can also enter the new patient by it, and then he can search the patients, and he can also generate a quick report or quick prescription without saving the data in database or in his file storing system. He can also manage his accounts, that means his income and expenses, and he can exit the software anytime. Okay, now I'm going to demonstrate with simple data. For example, today is 31st of January and a patient will come at evening. Evening means I have divided the appointment into 2 parts, the morning and evening. So evening means after lunch. Okay, so if anyone wants to come, you can see 5 p.m. and 5:10 perhaps, and his serial number is automatically put to 1. His name is, for example, what can I say? I just put Mr. James' name here also. You can also search the patient, but I'm not going to that right now. Phone number is, for example, 0123, and appointment for which problem. For example, here's heart. These are the sample data. I'm not a professional doctor. I'm a software engineer, so I put some data from my own. So these might not be realistic to you. Okay, so I just created, and you can see Mr. Zenith is appointment at 5:10. Your serial number 1. Now, if he wants to, okay, now if he wants to create the patient, he just click the create. Okay, the patient will be created here. So his name is Zenith. Okay, let me explain. This form will open when the patient really visits to him at 5:10. For example, it is now 5:10, then the patient has come. Okay, and maybe his age is 40, and for this name, I'm not going to fill those right now. I just want to save it. Save it, and it is saved, and his ID is 2. Let's go to the next level. What we can do in this page, all of his visits will come here, and from right now this patient hasn't come previously, so he has no previous visits. So let's create a visit now. Okay, now this is the investigation, or what can I say, the appointment. I don't know the exact doctor term, but this is the analysis page. For example, this patient has pain. Okay, you can see there are a lot of options in here. Pain where? At upper left jaw for, what can I say, 4 days. Reason? I don't know. Maybe maybe HDF, because I'm not exact about this. Okay, and either I can go to the next by clicking there, or go to previous, or I can just go to the PMH directly, or any button directly, no problem. Okay, these are the oriented as next and previous. Okay, so we go to next. For example, these are the past medical history, his medical past history. For example, jaundice. Do you have any jaundice? Yes, sir, I had 2 years ago. Do you have any heart disease? No, I don't have. Any operation? Yes, I had an operation. Yes, which operation? Heart operation, heart surgery. Heart surgery কবে হয়েছিল? When did you do that? Maybe on 2010. February 3. Okay, so these are the sample data we can put for medical history. And next we go to the allergy. These are the sample allergies. We can, for example, go to bus station. Why? No, for example, I don't know. SDF. Okay. The doctors can know better than me, so you can just ignore the data. Duration, cigarette. How much time are you having a cigarette? 4 years. Drug. The drug training now. Which drug are you now you taking? Okay, let's go to. I don't know. Let's just skip it. Okay, to the examination. Okay, on spot examination means what the doctor is doing with the patient. For example, carriage and G carriage, on which tooth, this tooth, and which surface. For example, this surface. Okay, let's add it. Okay, and for investigation, it will come later when the patient will come with the X-ray and the others. And the medication, the doctor will prescribe the medicines to the patient. Okay, we can put, okay, what can I say, paracetamol. I'm not good at the spelling. Weight, okay, which weight? Maybe 50 milligram. Quantity, he should eat one after 6 hours for 5 days. So in a sentence, the doctor is prescribing you will eat paracetamol 50 gram, uh, one per time after 6 hours each, and for 5 days. And special instruction, when should I eat? After meal. And add. Okay. Treatment plan, diagnosis, you can see scaling, polishing, RCT. I'm not going to make you boring. Work done. Okay, it's the another interesting thing. Work done has 4 or 5 different tabs. RCT, work done. You just pause the video and look through the data or the options. You can see everything and you can understand better than me. I'm not so sure about this. Okay, and last one is advice. I just put the sample data here. These are the sample advice list. We can just put, and we can just put the general also. Customize and general. These are the things, and we can just save it. Okay. Since I didn't put any drugs data, it is just notifying you didn't insert any drugs data. Do you want to save it? Yes, I want to save it without the drugs data. Okay, you can see now I have a visit. Okay, now Mr. Zenith has a visit, and he can also see the prescription. Okay, let's see the prescription. It will take some time because it is opening for the first time. Let's okay, the prescription has come. Let's full screen. Okay, so this is the prescription according to the data entered couple of minutes ago. It needs to be furnished, but this is sample data. If you can see advice, I just put the advices there: allergy, dust, go to bus station. I just entered all of this data couple of minutes ago, and this is then its name, name, age, gender, etc. has come. Okay, so the user can easily print this. Is the print option. I don't have, unfortunately, any printer in here right now, but if you click print, a printer will if the printer is attached, it will be automatically printed. Okay, so the printing option is done. The export report, you can also export the report as you wish, as RPT, or you can see Excel, XLS, CSV, RARTF, XML, whatever, PDF also. Okay, so there are a lot of options you can do with the prescription. Okay, let's close it. Let's close it also. Okay, let's close it. Okay, now today entry date today, I have Mr. Zenith. We can also search the rest patients by pressing the names or address, whatever. Okay, I'm just using our previous entry data. These are the previous data, and you can see he has previous 4 visits here. I'm not going to discuss right now, but these are the samples. You can also add the images of the patient or the X-ray images here, right click by clicking browse. Okay, okay. Now what? Prescription. This is a quick prescription. mm, Now the account part, the most interesting part. Okay, as my client representative says, there will be some fixed head, fixed setup on which the income will come and income and the expense will go. Fortunately, I just inputted couple of heads. Okay, I'm just searching all of the patients. You can also search according to the visit date or by name, or search all. Okay, I'm clicking the test one, and you can see Mr. Test one has come for 2 different problems. It's important. Please concentrate. Mr. Zenith, Mr. Test one has come for 2 different problems. One problem has the complaint SD whatever, and sorry for the garbage data, and the another one is for the complaint LSLD, the second one. Okay, the doctor contracted him, or what can I say, booked him for 3,000 taka or 3,000 BDD for the first complaint and 2,000 for the second complaint. But unfortunately, he didn't pay all alone, all in a single time. He wanted to pay the bill in what can I say, um, partially in every time. So these are the partial payments he did, and these are the partial payments he did for the second problem for the same person, the test one. Okay, now for example, Mr. Test has come today for another time, and he want to give another 500 taka for the first problem. So what should I do? Just click here, put 500, and save. It's saved, right? Now the paid amount is 1750, and you can also edit this. I can edit it to 100, and if I update it, you can see it's updated and it's 1800 right now. So what happens if the user come for a totally new problem? Okay, so just no problem, click here. It's maybe the first head, second is the head. Okay, I just told you it's the head. Okay, new problem. He wants to do it for maybe 1,000 taka, 1,000 taka, and it's saved. It's saved. It's a bug. It didn't come. Okay, let's click it again. Yeah, okay, it's come. New problem, date, bill 1,000, didn't pay anything. Just click here, and he wants to pay 500 right now. 500. It's saved. Okay, it's 500 saved. Now income is done. Now the expense is also quite similar. It has some head. Okay, let's put some head here. You can also change the head. Okay, tooth, for tooth, metal tooth for 500 taka. Save. Sorry, rent. Saved. Okay, now I can see the reports. Currently I have you can see your current month's income in a single click. So I have collected, not wanted, I have collected 1600 and 500 in from 2, and it's 200 sorry 2100 in a total. And the second part is the expense report for the total month. Okay, you can see these are the amounts. 2000 is expensed. Now as a total, my current month's balance is 2000, and 1000 is as income, and the expenses is colored as yellow. 1000, 500, 500 in a gross. It is 3000 is income, 2000 is expense, 1000 is gross, or what can I say, left. These are the account parts. Okay, this is all. I'm going to fix some, sorry, I'm going to fix these bugs and upload another video very soon, and I'm going to deploy this software to Mr. Zenith. Here is his phone number very soon. Thanks for watching.